I'm Dr. David Beaulieu, and I'm here with more news you can use. I want to talk to you today about an article in the 2013 Journal of the American Medical Association. The article said there were over 231,000 Americans receiving total hip replacement. Wow. Over 465,000, that's almost 500,000, Americans receive arthroscopic partial meniscectomy a year. That's work surgically on the meniscus of the knee. And it's very common that these patients are over 50 years old. Now, we're talking about joint dysfunction here. We're talking about wear and tear. We're talking about connective tissue not doing its job, not being replaced properly. Whenever I think connective tissue, the first thing I think of are my conversations decades ago with a two-time Nobel laureate, Linus Pauling. And what he taught me was that a basic building block of cartilage is collagen, and a basic building block of collagen is vitamin C. Without adequate vitamin C, you cannot build collagen, you cannot repair connective tissue. And humans, our species, of almost all of the animal species, with the exception of South American booble bats, guinea pigs, some New World monkeys, all make copious amounts of vitamin C. And I see subclinical vitamin deficiency of vitamin C in a great many people on an ongoing basis. I'm a ballroom dancer, and I dress, and so does my wife. We go places and we see a lot of people our age and older into ballroom dancing, women wearing beautiful gowns with a black and blue here and a black and blue there and a black and blue over here. And I'll often stop and talk with someone about that and say, gee, you've got a lot of bruising. Well, and I hardly have to touch myself in order to bruise. If my husband, it seems, holds my arm, I bruise. I don't understand what's going on. That's subclinical scurvy. And if it's at that particular point where all you have to do is lightly touch your bump and you're breaking blood vessels, you're at risk of stroke. But you're also at risk of breaking down hips and knees and other joints. And these people often require regular ongoing chiropractic care because they don't hold an adjustment. Their joints are constantly giving them trouble. And I will write down, go and get yourself some vitamin C, buffered, because ascorbic acid is not found in nature. Nature hates an acid or a base. Vitamin C, buffered vitamin C, at least 10% bioflavonoid. And I want you to take, depending upon the size of the person, a gram, 1,000 milligrams for every 50 pounds of body weight. So if it's a little 100-pound lady, a couple of 1,000 milligrams or 2 grams a day. If they weigh more, if they're close to 150 pounds, 3 grams a day. And usually inside of 60 to 90 days, someone comes up to me and shows me their arms and says, look, doesn't that look so much better? Because we've just identified and eliminated, cured, not treated, cured a case of subclinical scurvy, which could demonstrate as a bad hip, a bad knee, a stroke, which is a broken blood vessel. If you bang your head and you end up with a stroke, you fall down, bang your head, now you've got a stroke. That happens, it happens a lot. That's subclinical scurvy symptom. Are you getting black and blue? Think about it. A gram of vitamin C for every 50 pounds of body weight is the physiological dose level for vitamin C. And we've known it for 35 to 40 years. Medicine just isn't interested in it because there isn't any great money to be made in this area. If you're bruising easy, think vitamin C. If you've got knee problems, hip problems, back problems, joint problems, think vitamin C.